Hey there, welcome back to the channel. I'm so glad you're here today because we're diving into something that could literally save your life or the life of someone you love. If you're new here, hit that subscribe button and turn on the notification bell so you never miss life-changing health information like this. Trust me, today's topic is one you absolutely need to know about. Right now, at this very moment, there's a silent epidemic happening in medicine cabinets around the world. Millions of older adults are taking medications that their doctors prescribed with good intentions, but these drugs are quietly damaging their hearts. And here's what makes this so terrifying. Most people have absolutely no idea it's happening. I'm talking about common medications, pills that are sitting in your parents' bathroom right now, drugs that grandparents take every single day without a second thought, and cardiac surgeons, the people who literally hold human hearts in their hands during surgery, are now speaking out because they can't stay silent anymore. Picture this, you're a heart surgeon and you open up a patient for what should be a routine procedure. But instead of seeing a heart that matches the patient's age and medical history, you see damage that shouldn't be there, inflammation that doesn't make sense, weakened muscle tissue, dangerous rhythm problems appearing out of nowhere. And when you dig into their medical records, you keep seeing the same medications over and over again. That's exactly what's been happening in operating rooms across the world, and the research is finally catching up to confirm what these surgeons have been witnessing firsthand. Now, before we go any further, I want you to do something for me. Drop a comment right now telling me your age and where you're watching from. This information could be relevant to you or someone in your family, and I read every single comment, so let me know you're here with me. Major institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology have published studies that are genuinely alarming. We're not talking about rare side effects that happen to one person out of a million. These are significant cardiovascular risks affecting substantial percentages of users. Some of these drugs increase heart attack risk by over 40%. Others double or even triple the chances of developing life-threatening heart rhythm problems. And here's the part that keeps me up at night. Most patients taking these medications have no idea they're at risk. So today, I'm going to walk you through the medications that cardiac experts are most concerned about, and I'm going to save the most dangerous one for last, because there's one drug on this list that surgeons are calling the silent heart killer. Let's start with something that might already be in your medicine cabinet. Proton pump inhibitors, or PPIs for short. You probably know them as Prilosec, Nexium, or Prevacid. These are the purple pills and similar medications that millions take for acid reflux and heartburn. Now, don't get me wrong, for short-term use, these can be incredibly helpful. The problem is that so many older adults have been taking them for years, sometimes even decades, and the research on what this does to your heart is honestly shocking. A landmark study examined nearly 3 million patients and found that PPI users had a 16 to 21% increased risk of heart attack. Now, you might think, okay, that doesn't sound that dramatic, but when you consider how many people take these drugs every single day, we're talking about hundreds of thousands of additional heart attacks potentially linked to these medications. Here's what's happening inside your body. PPIs reduce the production of something called nitric oxide in the cells lining your blood vessels. Nitric oxide is absolutely critical for heart health. It keeps your arteries flexible, prevents dangerous blood clots, and fights inflammation. When those nitric oxide levels drop, your arteries become stiff, your blood pressure rises, your risk of blood clots shoots up. It's like your cardiovascular system is aging faster than it should. The good news, many people can manage acid reflux with lifestyle changes. Losing excess weight, eating smaller meals, avoiding food close to bedtime, even just elevating the head of your bed can make a huge difference. And there are safer medication alternatives if you still need help. But PPIs are just the beginning. Let me tell you about something that catches almost everyone off guard. Certain antibiotics. I know what you're thinking. Wait, antibiotics? But those save lives. And you're absolutely right. Antibiotics are one of the greatest discoveries in history, but certain types have been conclusively linked to serious heart problems in older adults. The biggest offenders are called fluoroquinolones. These include drugs like Cipro, Levaquin, and Avelox. A major study looking over 7 million patients found something absolutely terrifying. These antibiotics were associated with a 66% increased risk of aortic aneurysm and dissection. That's when the main artery in your body develops a dangerous bulge or tear. This is often fatal, and the elevated risk lasts for about 60 days after taking the medication. These antibiotics can also cause dangerous changes in your heart's electrical activity, leading to potentially fatal irregular rhythms. The FDA has issued multiple warnings, saying these should only be used when absolutely necessary and when safer alternatives aren't available. For simple infections like urinary tract infections or sinus infections, older antibiotics like amoxicillin are usually just as effective and much safer for your heart. If your doctor prescribes one of these fluoroquinolones, it's absolutely okay to ask, is there a safer alternative that would work for me? Now, the next one on this list is something that's probably in your bathroom right now, and millions of older adults take it regularly for pain relief without realizing the cardiac danger. I'm talking about NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, Aleve, Celebrex, brand names like Advil and Motrin. These are phenomenal at reducing pain and inflammation, right? For younger people using them occasionally, the risks are pretty minimal. But for older adults taking them regularly for chronic conditions like arthritis, the consequences can be devastating. A comprehensive analysis of over 350,000 patients found that high-dose NSAID use increased the risk of major cardiovascular events by about 1/3. Celebrex increased heart attack risk by 37%, ibuprofen by 44%. And here's what really shocked me. Even short-term use was associated with increased cardiovascular risk. The risk started climbing within the first week of use. I get it. Chronic pain is debilitating. It affects your quality of life, your ability to do the things you love. But there are alternatives. Acetaminophen, which is Tylenol, doesn't carry the same heart risks. Topical creams applied directly to painful areas deliver much less medication into your bloodstream. Physical therapy, weight management, targeted exercises, all of these can reduce the need for pain medications altogether. Now let's talk about something that affects millions: diabetes medications. Diabetes itself dramatically increases heart disease risk, which is exactly why the choice of medication matters so much. Not all diabetes drugs are created equal when it comes to your heart. Some newer medications actually protect your heart, but older drugs, particularly a class called sulfonylureas, like glyburide and glipizide, have been linked to increased cardiac risk. A major study following over 250,000 diabetic patients found that sulfonylurea use was associated with a 20% increased risk of cardiovascular death compared to other diabetes medications. These drugs can cause dangerous drops in blood sugar that trigger stress hormones, and they may accelerate the buildup of plaque in your arteries. The contrast with newer diabetes medications is remarkable. Drugs in the SGLT2 inhibitor class and GLP-1 receptor agonists have actually been shown to reduce the risk of heart failure and cardiovascular death. If you're taking an older sulfonylurea for diabetes, this is absolutely worth discussing with your doctor. We're getting into the really serious territory now. Next up, certain sleep medications. Sleep problems are so common in older adults. Nearly half of people over 65 struggle with sleep. The temptation to reach for a sleeping pill is completely understandable, but certain sleep medications have been linked to cardiovascular consequences that honestly make insomnia seem like the lesser problem. Z drugs like Ambien, Sonata, and Lunesta are among the most commonly prescribed. A large study examining over 30,000 patients found that these hypnotic sleep aids were associated with a 4.5 times greater risk of death, with cardiovascular events being among the leading causes. These drugs suppress your breathing, which worsens sleep apnea, a major risk factor for heart disease and stroke. They also increase fall risk, and falls can trigger cardiac events in older adults. Better approaches exist. Cognitive behavioral therapy for insomnia has been proven more effective than sleeping pills for long-term improvement. Good sleep hygiene, keeping a consistent schedule, avoiding screens before bed, keeping your bedroom cool and dark, all of this helps tremendously. Okay, we're down to the final two, and these are the ones that cardiac surgeons are most worried about. Number 2 might surprise you: certain antipsychotic medications. These are sometimes prescribed to older adults for agitation or behavioral problems associated with dementia. A landmark study in the New England Journal of Medicine examined over 44,000 elderly patients and found that those taking these drugs had roughly double the risk of death compared to non-users. The excess deaths were primarily from sudden cardiac causes. These drugs can cause dangerous heart rhythm changes, metabolic problems that increase heart disease risk, and sudden drops in blood pressure that lead to falls and cardiac events. The FDA has issued black box warnings, yet these medications remain disturbingly common in nursing homes and care settings. And now we've arrived at the #1 drug on this list, the one that cardiac surgeons say poses the greatest threat to the hearts of older adults. Number 1. Opioid pain medications. We're talking about oxycodone, hydrocodone, morphine, fentanyl, and tramadol. Brand names like OxyContin, Vicodin, Percocet. A massive study analyzing data from over 575,000 patients over age 65 found that long-term opioid use was associated with a 65% increased risk of cardiovascular death. Another study found that starting opioids was associated with more than double the risk of cardiovascular events in the first 30 days of use. Here's what's happening. Opioids cause respiratory depression, meaning they slow and weaken your breathing. This leads to lower oxygen levels in your blood, which puts tremendous stress on your heart. During sleep, oxygen levels can drop dangerously low, triggering inflammation and damage to blood vessel walls and heart muscle. Chronic opioid use causes changes in heart structure that resemble heart failure. These drugs disrupt your autonomic nervous system, making your heart less able to respond to stress. They suppress immune function in ways that may promote plaque buildup in arteries, and they interact dangerously with other medications that older adults commonly take. The path forward is challenging, but absolutely possible. Pain management specialists now emphasize approaches that combine physical therapy, interventional procedures like nerve blocks, and cognitive strategies. Many patients find their pain actually improves as they gradually reduce opioid doses under medical supervision. Look, the cardiac surgeons sounding this alarm aren't telling you to throw away your medications. What they're urging is informed conversation with your healthcare providers. Many of these drugs seemed reasonable when they were prescribed, but the research has evolved, our understanding has deepened. You deserve to know what the research shows, so you can make informed decisions about your own health and your own heart. The heart damage from these medications is often preventable, but prevention requires awareness, conversation, and a willingness to explore safer alternatives when they exist. Here's what I'm really curious about. After watching this video, are you planning to have a conversation with your doctor about any medications you're currently taking? Or do you feel like bringing up these concerns might damage your relationship with your healthcare provider? I want to know what's holding you back or pushing you forward, because this conversation matters more than most people realize. Drop your thoughts in the comments below. Are you or someone you know currently taking any of these medications? Have you noticed any unexpected heart symptoms since starting them? Share your experiences with us in the comments. We genuinely love hearing from you, and your story might help someone else make an important decision about their health. If this video opened your eyes to something you didn't know before, please hit that like button. It helps us reach more people who need this information. And if you haven't already, subscribe to the channel and turn on that notification bell so you never miss crucial health content like this. Take care of yourself and your loved ones. Thanks so much for watching, and I'll see you in the next video.